Hormones play a crucial role in regulating various physiological processes in the human body. Hormone receptors, located on the surface or inside cells, are specifically designed to bind with hormones, initiating a cascade of intracellular events known as signaling pathways. These pathways ultimately lead to the activation or suppression of target genes, influencing cellular responses. Understanding the complexities of hormone receptors and signaling pathways is essential for comprehending the mechanisms of hormone action and developing therapeutic interventions. In this lecture, we will explore the intricate details of hormone receptor interactions and highlight their clinical significance. Receptor-ligand binding kinetics involve the intricate processes by which hormones bind to their respective receptors. The binding affinity, rate constants, and equilibrium constants determine the overall efficiency and effectiveness of this interaction. Factors such as the concentration of the ligand, receptor density, and receptor conformation influence these kinetic parameters. This understanding aids in uncovering the mechanisms underlying hormone receptor interactions and allows for the development of therapeutics targeting these pathways. GPCRs represent a large family of membrane-bound receptors that mediate the actions of numerous hormones and neurotransmitters. These receptors rely on G proteins as mediators of intracellular signaling. Upon ligand binding, conformational changes within the receptor promote the activation of specific G proteins, leading to the activation of downstream effectors such as adenyl cyclase and phospholipase C. Through these pathways, GPCRs regulate diverse cellular processes, including metabolism, neurotransmission, and cardiovascular function. In contrast to GPCRs, RTKs are another critical class of receptors involved in hormone signaling. RTKs possess intrinsic kinase activity, allowing them to phosphorylate specific tyrosine residues upon ligand binding. This phosphorylation activates downstream signaling cascades, leading to cellular responses such as proliferation, differentiation, and survival. Dysregulation of RTKs is implicated in various diseases, including cancer. Targeting the aberrant activity of these receptors has shown promise in therapy development. Second messenger systems play pivotal roles in transmitting extracellular signals across the plasma membrane to the intracellular milieu. The activation of GPCRs or RTKs leads to the generation of second messengers such as cyclic adenosine monophosphate, CAMP, inositol triphosphate, IP3, and diacylglycerol, DAG. These secondary messengers can modulate intracellular calcium levels, activate protein kinases, and regulate gene expression. The intricate regulation of these systems is crucial for maintaining cellular homeostasis. Nuclear receptors are a distinct group of hormone receptors that, upon ligand binding, translocate to the nucleus to modulate gene expression. These receptors typically bind to specific DNA sequences called hormone response elements, enhancing or suppressing gene transcription. Nuclear receptors play critical roles in various physiological processes, such as metabolism, reproduction, and immune response. Dysregulation of nuclear receptor signaling can lead to metabolic disorders and autoimmune diseases. Signal transduction cascades are complex series of events that relay the activation of a receptor at the plasma membrane to the nucleus, resulting in cellular responses. These cascades involve protein phosphorylation, activation of kinases, and interaction with scaffolding proteins. Examples of well-known signaling pathways include the mitogen-activated protein kinase, MAPK, pathway, the phosphoinositide 3 kinase, PIEK/ACT pathway, and the JAK-STAT pathway. A thorough understanding of these cascades is crucial for unraveling disease mechanisms and developing targeted therapies. In the realm of hormone signaling, it is important to understand the concept of receptor desensitization and resensitization. When hormones bind to their respective receptors for an extended period or repeatedly, the receptors can become less responsive to further stimulation. This adaptive mechanism prevents overactivation of cellular responses. The desensitization process involves internalization of the receptors into the cell, dephosphorylation, and recycling to restore their responsiveness. Any disruptions in this balance can lead to disease states and affect the effectiveness of therapeutic interventions. In the realm of intracellular signaling pathways, it is evident that they do not function in isolation. Rather, they often engage in crosstalk, a phenomenon where signals from one pathway can impact or interconnect with another pathway. Crosstalk can manifest at different levels, such as receptor interactions, shared downstream effectors, or even regulatory interactions among transcription factors. This intricate interplay between pathways gives rise to a sophisticated modulation of cellular responses and subsequently poses a challenge when designing therapeutic interventions. Hormone resistance syndromes are conditions in which tissues become unresponsive to the actions of hormones, resulting in compromised signaling and clinical implications. An instance of such syndrome is insulin resistance, prevalent in type 2 diabetes, and resistance to thyroid hormones witnessed in rare genetic disorders. Comprehending the underlying mechanisms of these syndromes is crucial for enhancing treatment approaches and enhancing patient well-being. Aberrant hormone receptor signaling plays a prominent role in various cancers. For instance, dysregulated estrogen receptor signaling contributes to breast cancer development and progression. Targeting hormone receptors with selective modulators or inhibitors has emerged as a valuable therapeutic strategy in managing hormone-related cancers. Unraveling the intricacies of these receptor-mediated pathways aids in personalized medicine approaches and the development of novel therapies. Autoimmune diseases can disrupt the normal functioning of the endocrine system by producing autoantibodies that specifically target hormone receptors. This can result in various endocrine dysfunctions. A prime example is Graves' disease, where autoantibodies are directed against the thyroid-stimulating hormone receptor, leading to excessive production of thyroid hormones and the development of hyperthyroidism. Another example is Addison's disease, characterized by autoantibodies targeting adrenal antigens, ultimately causing adrenal insufficiency. Studying the intricate immunological mechanisms implicated in these diseases offers opportunities to develop targeted immunotherapies aimed at restoring hormone receptor balance and function. Pharmacological interventions targeting hormone action have revolutionized the management of various endocrine disorders. These interventions involve the use of agonists, antagonists, or modulators to enhance or inhibit hormone receptor signaling. Advancements in drug design have allowed for increased selectivity and reduced side effects, improving patient outcomes. Understanding the molecular basis of hormone receptor interactions aids in the rational design of pharmacological interventions. In this extensive script, we have explored a comprehensive range of topics in endocrinology, discussing receptor-ligand interactions, signaling cascades, disease implications, and therapeutic interventions. The intricate understanding of these mechanisms is essential for clinical practice, guiding the diagnosis and treatment of endocrine disorders. As future physicians, it is crucial to continually expand our knowledge in this field to provide optimal patient care.